Good afternoon. Good afternoon. My name is Dhanalakshmi, clinical psychologist, Chandra Rheumatology and Immunology Center. Today I am talking about psychological impact on scleroderma. First, we have to know about what is scleroderma. Scleroderma is also known as the systematic sclerosis. Is a group of rare disease that involves the hardening and tightening of the skin. It causes problems in the blood vessels and internal organs and digestive tract. Scleroderma is more common in the women than in men. This disease usually appears between 30 to 50 ages. Now we can see about the symptoms. What are the symptoms? Like swelling of the hands, feet, red spot on the skin, excessive calcium deposition in the skin, and rigidity, tight mask facial skin, pain and symptoms in the joints, persistent cough, shortness of breath, heartburn, and difficulty in swallowing, digestive and gastric some problem, constipation, and weight loss also. Some some patients they will get fatigue, air loss also. What are the causes of scleroderma? Scleroderma is a type of autoimmune disorder. In this condition, the immune system mistakenly attacks and damage the healthy body tissues. The causes of scleroderma is unknown because we don't identify that. A buildup of substance called collagen in the skin and other organ leads to the symptom of the disease. What are the functional effects? How it will affect the like patient's personal life like that? Like they it will affect scleroderma as an impact on daily activities such as family, work, recreation, and education, and future responsibilities. How mental health affects scleroderma affects the mental health. We will see about that. Scleroderma patients are like 4 to 5 times more likely to receive a psychiatric diagnosis than general population, like major depressive disorder or generalized anxiety disorder, adjustmental disorder, some somatization disorder also. We can see first what is the how depression will affect the scleroderma. Scleroderma is how are affecting the scleroderma patient, like depressed mood, like everyday loss of interest, weight loss or significant weight loss or weight gain, sometimes like slowing down thought and reduction of the physical activities, fatigue, loss of energy. Sometimes they will feel like a worthlessness, excessive inappropriate guilt. They will feel sometimes guilty feeling also. Then recurrent thoughts of death and recurrent suicidal ideation also. Like some patients, they will get like everyday depressed mood because of the hardening and tightening the skin. They can't do some works and all. They are not able to go to the office. They are not doing some work and all. That's why they will feel like depression mood. Feeling that can lead to depression. While these are some, while these are the signs of the depression, there are a number of feelings that can lead to depression. Patients with scleroderma this include like fear, anxiety, sometimes uncertainty about the future. Like they will feel fear about the future also. Sometimes they will get anxiety. Why it happens like this, like that? They will think more and more. That's why they will get depression. Some frustration. Frustration means like they have some physical pain, physical irritation, or itching problem like that. That's why they'll get frustration also. Lose of control over the life. Then we can know about the GAD, generalized anxiety disorder. This is the presence of excessive anxiety and worry about variety topics, events, or activity. They will worry about like some topics or events or anything like symptoms like that. It will occur like often like more than like 6 months. Then restlessness, to lose energy, fatigue, irritability is there, im- impaired concentration, or feeling through the mild goes blank. Increase the muscle ache also and soreness also. Difficulty, they won't sleep properly, difficulty in sleeping also. Then next one is a body image. Most of like scleroderma patient is thinking about the body image because most people with scleroderma they will experience change in their appearance because of tightening skin or anything. They have some problem with physical appearance. Many changes will only be noticeable to you. Other changes may be large enough to that notice to them. Scleroderma changes like changes in the fingers and feet, face. Some people in the thickening the skin thickening can also involve forearms, upper arm, chest, abdomen, lower legs, thing. Like early symptoms may include like swelling, itchiness also. What are the emotional effects they will face? Various aspects of this disease take toll on the emotional life of the patient, like guilty, loss, hostility, disappointment, fear, and uncertainty, self esteem, some body image also. What are the intervention we will use for this? One is psychoeducation. For scleroderma or any kind of patient, first we will give the psychoeducation about the problem because they will get to know what is going on like that. We will give the psychoeducation to family members also, then patient also, how to manage that thing. Second thing, pain management. Through pain management, we will plan it, plan the healthcare providers to help the people to manage all kind of the pain. Pain management approaches include like medications, exercises, injections, or other therapies. Next is stress management. Stress management is defined as a tool, strategies, or technique that reduce the stress and reduce the negative impact on stress. Your mental health or physical well-being is variety of technique can use to manage the stress. This include the mental and emotional and behavioral strategies. Then we will do the CBT also. CBT teaches you coping skill for dealing with different problems. It focuses on how your thought, belief, and attitude affect your feelings and actions also. Then behavior training and behavior modification, like healthy eating habits, like walking or some exercises and relaxation, yoga. These all the behavioral life behavioral training modification. Next, mindfulness techniques. Mindful exercise like a deep breathing and medication, stress relievers. This exercise also help to slow down your mind and body. and can offer you pain relief. Then exercise also, some active exercise like it can stimulatory reduce your pain and help like elevate your depression and anxiety also. Some kind of exercise help to, you will do some activities or exercise means it will reduce your pain also. Manage the medication, like you have to take regular medication, because it will give some like relieving or any inflammation is there means it will reduce that. Reduce the isolation and medication. Managing medication, antidepressant medication may help with mood stabilization. Consult your doctor about the medication and remedy recommendation of anxiety or depression are persistent to get worse. Exercise also, activities like water activities or bicycling create less stress on into your joint. It can stimulate reduce the pain and help the already with the depression and anxiety. Reduce the isolation and maintain the socialization first. Because of scleroderma patient, they will think about the body image. They will think about something. They won't mingle with others. Pain may limit mobility. Isolation faster. Isolation faster the depression. If you cannot go out, spend time with you cannot go out, spend time with trusted friends and family members can come to visit you. Like you have to maintain your socialization. Then and group counseling also available. Then individual counseling also help the patient to. Group counseling also helps patient with the scleroderma. Then family counseling also help the patients to scleroderma, because if family members know about this disease, they will also help the patient. Thank you for giving the opportunity. Thank you.